Sometimes an individual has more impact than the whole institute. We are lucky to have such a visionary leader like respected Professor Dr. Syed Amir Gilani, who always has guided us with creative and innovative ideas. We are especially thankful to Professor Dr. Syed Amir Gilani, Dean Faculty of Allied Health Sciences at the University of Lahore, for planning and executing this series of webinars in the best effective way. What a beautiful moment it is on which we are having an excellent learning opportunity in the form of today's webinar, and I am so happy to be sharing it with all of you. I hope today's webinar is going to be very effective, relevant, and useful for all of you. I am pretty much sure that most of you are familiar with the speaker of today's webinar, who is a well-known personality in the medical community of Pakistan. It is my pleasure to introduce respected Professor Dr. Ashfaq Ahmed, who is currently working as a head of the department. He is the founder head of the department at the University Institute of Physical Therapy, as well as Associate Dean of Faculty of Allied Health Sciences in the University of Lahore. He is also the chairman of Pakistan Physical Therapy Association, editor of Pakistan Journal of Pakistan Journal of Physical Therapy, member of the National Curriculum Revision Committee at the Higher Education Commission of Pakistan, member of World Association of Laser Therapy, and member of North American Laser Therapy Association. He was the first PhD graduate in the field of physical therapy in Pakistan. He has a number of certificates related to field, and with special interest in the laser therapy, he has also published more than 100 research papers in the national and international scientific journals. Shortly, inshallah, speaker will start his presentation. Now, I will request respected Professor Dr. Ashfaq Ahmed to start his presentation on Introduction to Low-Level Laser Therapy, Future of Medicine. Sir, please.
Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Sayyidina Muhammadin wa ala alihi wa sahbihi wa sallim. Thank you so much, Dr. Syed Asadullah Arslan, for such a comprehensive introduction. Although I am a little confused whether my introduction has more impact or laser therapy has more impact. Thank you so much anyways. I'm extremely thankful to Professor Dr. Syed Amir Gilani, who is Chairman Board of Governors of Afro-Asian Institute of Allied Health Sciences, for giving me an opportunity to share knowledge on this wonderful platform. I'm also thankful to my University of Lahore, the whole management, for such an excellent collaboration between two institutions for the noble cause of spreading the knowledge. Inshallah, this is the way of continuous process of doing so many things in future. Inshallah, we are going to invite so many other speakers nationally as well internationally on this platform. I'm also thankful to the all audience participants, my friends, colleagues from national as well as internationally. They have participated. I've heard that more than 1,000 registrations and so many people are on the Facebook going to catch this webinar live on the Facebook as well as on the social media. So let us start with today's lecture, that is low-level laser therapy or photobiomodulation, future of medicine. Our today's topic is Introduction to Low-Level Laser Therapy, that is also known as LLLT, or photobiomodulation or cold laser therapy. It is considered to be as future of medicine. I will explain in my upcoming slides that why we call it as future of medicine, why there is low-level laser therapy is considered as one of the best modality used in physical therapy and in medical sciences. Before I go further, I would like to tell that since we have 8th September, that is again the World Physical Therapy Day. So on this occasion, I would like to share one thing, that if we want to excel as a professional, So we have to at least opt 2 to 3 things. That the first thing is we have to do the research, because there is huge gap, huge potential in the field of physical therapy, that we do this as much as we can do the research in its true spirit. Secondly, there is a need to explore, to discover new modalities, especially the low-level laser therapy. We have a couple of topics in our institute, that is, people are doing work on low intensity pulse ultrasound, shockwave therapy, and so many other things. So this is the time then that we can explore further modalities if we want to excel in the field of physical therapy. Once you understand the mechanism of these upcoming modalities, you will, believe me, you will enjoy starting working with these modalities. In today's lecture, we will go through on certain things, the introduction, a couple of slides on what is LLLT, history, present, and future. We will discuss mechanism, 4 stages of mechanism: primary, secondary, tertiary, and quaternary. Then definitely we will go through for clinical benefits, that is tissue repair, inflammation, edema, analgesia. These are the 4 pillars which we claim that we can use. We can address all these 4 pillars or 4 benefits, clinical benefits, with the help of low-level laser of physical laser therapy. Then we will have few slides on physics, that is what are photons, packets of energy, wavelength, how it is important for laser therapy. We can't go further without basic understanding of electromagnetic spectrum, laser versus LED versus sunshine, dosimetry, wavelength, dose, pulse, treatment time, how many times is required, how often is necessary, treatment method, like injury, lymph nodes, nerves, and trigger points. So other clinical areas like safety, contraindications, regulations, these are the important highlights of today's webinar, inshallah. So if we see that nomenclature, initially it was low-level laser therapy, also known as cold laser therapy. Photobiomodulation is the latest term, which in recent meeting of World Association of Laser Therapy, it was approved that now it should be called as photobiomodulation. Initially, it was also considered as laser biostimulation. So these are the different names, which I already mentioned, that low-level laser therapy, LLT, low-level light therapy, photobiomodulation, PBM therapy or PBMT therapy. These are the nomenclatures which normally used in different scientific journals or scientific works. So let us start with basic, that what is laser. If you see on my screen that laser is light, L is light, amplification by stimulated emission of radiation. I think we have very much aware of this term since our early school age days, that laser is light amplification by stimulated emission of radiation. If we go further in detail, light amplification is creating more light from a little light. So light amplification means that you are creating more light from a little light. Stimulate means to cause something to happen. An emission is a thing that's made and released from an object. Radiation is a kind of energy. So laser is basically is a game of 3 or 4 things, that what we are basically doing, we are creating more light from a little light. We are causing stimulation, we are causing release of energy, and there is a kind of energy radiation. So light amplification by stimulated emission of radiation means creating more light by causing the release of energy. So this is the main concept, this is the main mechanism which you should keep in your mind, that creating more light by causing the release of energy. So this will help you in understanding the basic mechanism of laser working, how laser works. So we are putting energy into the cells, into the mitochondria to alter certain cellular functions like photochemical changes, which we will discuss in upcoming slides. So once again, if we see what is low-level laser therapy, it is a form of laser medicine. Monochromatic light emitting diodes, monochromatic means of same wavelength, alters cellular functions. So this is the modality which we claim that it changes cellular functions, it alters cellular functions. There are so many photochemical changes which are induced due to the application of the laser medicine or laser light or light therapy. So here is the experimental evidence of biological effects of low-level laser therapy. This is very interesting that when I was working on my PhD topic back in 2011 and 12, so this was the article, this was the main thing that was come across through my routine search of literature. When I saw this, that laser therapy also increases collagen synthesis, then angiogenesis, reduction in inflammation, increased protein synthesis, enhanced cell function, increased ATP production. So I was in search of something new that is beyond the level of pain or beyond the level of increasing the muscle strength, muscle power, endurance, or achievement of other functional activities. So I try to attempt the healing of something like tendon. You know, tendon ligaments mostly made of collagen. So if a modality is increasing the collagen synthesis, it means you can also use this modality for the healing of any kind of torn ligament, torn tendon, torn muscle, or even we can also see so many other things. Like in future, I will share few things, future horizon windows that we can work on vertebral bodies, meniscal tears, and even the disc problems. These all can be addressed by such kind of modality, the laser therapy. If you see the equipment and treatment examples, this is one of the famous brand, that is Thor. You can see the complete package of this kind of machine. It has a big cluster probe, small cluster probe, as well as pencil probes and 2 dental probes, then point locators. Similarly, other models are Omega. These two are very known models like Thor and Omega, although we have so many other models like K Laser, that is an American brand, and similarly Domer Laser from China. Every machine has different functions and different literature, definitely, but we find most of the literature on the machines of Thor and Omega XP model. So this is not enough that we simply buy a machine, a modality, and just start treating the patient, because now the things have been changed. Now you have to think differently while treating any patient. Here you can see in this window that we are treating different sites while treating any condition. Like here we are treating the lymph nodes, this is the injury area, this is the trigger point area, and here we are directly addressing the nerves. So this is the game of applying laser light into different areas. So the main theme of today's webinar is, whenever we should treat any condition like any musculoskeletal pain or any ligament injury, tendon injury, or so many other list of conditions we will come across throughout. So we have to think, we have to treat the condition into 4 aspects. while treating the injury area, you have to consider the lymph node area, as well as if there is any trigger point, you can find it through point locator. And similarly, with the help of nerves and nerve plexus as well as the nerve roots, we can manage, we can modulate, we can control the pain, especially, and the frequency and the doses and the different parameters are different for each and every condition. Again, if we see, the effects are totally photochemicals. If you see, effects are total photochemicals, like photosynthesis in plants. There is no heat of this modality. Vitamin D synthesis, suntan, blue light for neonatal jaundice, UV for psoriasis and vitiligo. One thing is for sure, that there is not any known contraindication or side effect of using laser therapy or photobiomodulation, except this is greatly contraindicated to treat the eyes. It is directly, it is not recommended to look at the beam of the laser directly at the laser. According to international standard IEC 608251, laser can be classified into 5 categories. The class 1 is very low power laser, even less than 1 milliwatt. Whenever we go to any market or superstore, used in barcode readers, this is class 1 laser. Class 2 is low power lasers emitting visible light, limited to less than 1 milliwatt visible light only, used in laser pointers, which we use for highlighting the points during any presentation. Then class 3 are low power lasers emitting visible light limited to less than 5 milliwatt. Class 3B is the laser emitting 5 milliwatt to 500 milliwatt, and some lasers emitting infrared light below 5 milliwatt, used for LLT and PBMT, photobiomodulation therapy. This is the major concern to us, that laser therapy belongs to class 3B classification of the laser. So this is the range 5 milliwatt to 500 milliwatt. If you remember that we use different pencil probes, 100 milliwatt, 200 milliwatt, even 30 milliwatt. So these are the different laser emitting diodes as well as probes. Then class 4 lasers emitting over 500 milliwatt, that is used in surgery. In simple words, that there are 3 major types of laser: the soft laser, mid laser, and power laser. Soft laser is used in the treatment of eye conditions, and power laser used in surgery, as we discussed here, class 4 used in surgery. And mid laser or cold laser or low level laser is used in physical therapy and other related medical fields, where we use mid laser, and the range normally used in mid laser is 600 nanometer to 1000 nanometer. And here is the range of milliwattage, that is 5 milliwatt to 500 milliwatt is the range. Before we go further, we should have a glimpse of history of low-level laser therapy. This is not a new thing. As we know, this is also called the low-light therapy. So Einstein, 1916, first proposed the phenomena of stimulated emission. I will try to highlight the important. Then in 1967, Professor Andre Master discovers laser biostimulation. This is very interesting, that he was actually checking the role of laser on putting it on the rats, whether it produces cancer or not. He made 2 groups of rats and shaved them. And then on experimental group, when he applied the laser therapy, although they didn't get cancer, but to his surprise, that the experimental group on which he applied laser biostimulation, the hair growth was more quicker than the non-experimental group. So he immediately put a label on this, that this is some kind of laser can produce biostimulation. So this was Professor Mestre is considered the father of laser therapy or light therapy. Then in 1998, NASA conducted LED therapy wound healing study of space. In 2030, FDA cleared laser therapy. In 2005, spinal cord regeneration. In 2006, LLT published in Nature and Pain, the most highlighted and very high ranked journal. These are the Nature and Pain. Then in 2008, World Health Organization recommended laser therapy for neck pain. Then Lancet in 2009 also recommended laser therapy for the reduction of immediate pain in acute neck pain and for up to 22 weeks in patients with chronic neck pain. American Physical Therapy Association guidelines recommended laser for Achilles tendinitis, and International Association for Study of Pain, Global Task Force on Musculoskeletal recommended laser for myofascial pain syndrome. You just see the horizon. You see the variety of the conditions we are going to treat with laser therapy worldwide. There is a huge work on such kind of thing. Then another journal, BJSM, Systematic Review of Surgical Conservative Intervention for Frozen Shoulder, found strong evidence for laser therapy. Similarly, in 2011-12, a multinational association for supportive cancer care recommended laser therapy for oral mucositis. Then another journal, J Cancer and Journal Applied Oral Science, seems clear that the use of laser brings benefit when properly applied and administered. American College of Physicians also recommended, gave the strong recommendation for low-level laser therapy as a non-invasive treatment for acute, subacute, and chronic low back pain. In 2017, Blue Cross Blue Shield reimbursed for oral mucositis. You will be surprised that there is a huge role of laser therapy in most of the dental treatment as well. Especially, I will share one paper in the end that after the extraction of third molar, when you apply low-level laser therapy, so it is more effective even with medication. Then NICE guidance for UK recommended laser for oral mucositis. Similarly, a BMJ systematic review and meta-analysis, PBM significantly reduces pain and disability in knee osteoarthritis. So this was all about the history of the laser therapy, step-by-step progress in the field of laser therapy. So if we see the strength of the evidence, like there is huge literature on this modality. The strongest evidence we find everywhere in the literature, that is musculoskeletal pain, injury and dysfunction, oral mucositis, muscle strength, endurance and recovery. You will definitely find strong evidence on this. Then moderate evidence, lymphedema, wound healing, neuropathic pain, fibromyalgia, orthodontics, cognitive. Therapy has some effect on the cell, that is absorption. Cytochrome C oxidase, which I have already mentioned, that is the terminal enzyme of electron transport chain, absorbs red and near infrared light. Mitochondrial and cellular membranes may also absorb near infrared light. The second important phase is the secondary effect. Mitochondrial effects, nitric oxide, reactive oxygen species, and ATP. In stressed or ischemic tissues, mitochondria produce nitric oxide, as I've already mentioned, displaces oxygen from CCO, so oxygen no longer takes electrons from CCO, so electron transport stops. Lack of electron flow causes production of ROS, often referred to as oxidative stress. It also reduces production of hydrogen ions, so ATP synthase no longer makes ATP. So what PBM light is absorbed by CCO, dissociates MTNO, mitochondrial nitric oxide from CCO, allowing oxygen accept electrons from CCO, electron transport is restored, restored oxidative stress is reduced, hydrogen ions are restored, and ATP is restored. So here you can see the pictorial representation that less oxidative stress and more ATP. I think we can see this all in detail in the upcoming video. Tertiary effect, intracellular effects. Too much oxidative stress for too long causes translocation of NF-kB. This is transcription factors, the master switch for inflammation into nucleus. When there will be too much oxidative stress and it will remain for too long, it will cause a translocation of NF-kB into the nucleus. What it will do there, that induces gene transcription factor associated with inflammation and cell death and triggering of many genetic weaknesses. Like too much or too long damage or disease ultimately lead into many genetic weaknesses. PM reduces oxidative stress, leading to reduced NF-kB activity, improved exchange of calcium ions, secretion of growth factors, activation of enzymes and other secondary messengers. This is again the summary of all these factors, I think. Primary effect, secondary, tertiary, and quaternary effect, ultimately going through all these biological and photochemical changes. In the end, you will get reduction in the pain, you will reduce the inflammation, decrease the edema, and there will be enhanced tissue repair. So once again, if you see through this that the primary effect of low-level laser therapy, that is absorption, secondary effect mitochondrial changes, NO release, ATP increase, tertiary cellular, and quaternary, we will just go through that. The neighboring cells, they get the benefit of from those cells who get energy from low-level laser therapy. And ultimately, after all these four processes, there is increased healing, less inflammation, less pain, and improve in function. The last is quaternary effect, extracellular, bystander, and systemic effects. As I just mentioned, that local responses lead to remote effects on cells that have not absorbed light, secretion from cells that have absorbed light from affect neighboring cells. So the neighboring cells get energy from the cells who are directly in touch with the laser therapy, who are directly getting energy from the laser therapy. This is called bystander effects. So this is quaternary effect. Analgesic effect. Analgesic effect is the opposite mechanism. High irradiance. You have to see two things side by side. That laser is basically claiming two things. The first thing, to reduction of pain. The second is tissue repair, that is the healing. So if you want to reduce the pain, so this is the opposite mechanism mechanism to the healing. The analgesic effect is the opposite mechanism, high irradiance. I tell you in the next slide that what is irradiance, that is power density. High irradiation, high dose laser inhibit ATP production in C fibers and A delta fibers. This effect leads to local nerve block and we get super analgesia or something like this. I must quote here that in UK, when I went there for my laser courses, I saw a few patients that normally laser therapists use laser therapy to give the super analgesia before extraction of third molar. So this is such kind of effect of a laser therapy that we can produce super analgesia before extraction of third molar tooth. Here I would like to share a little video just of 1 minute, just to show the basic mechanism of working of Akif. You can see the video share?
Yes, sir, it's visible.
Okay.
This is a normal cell, cytochrome C oxidase. The terminal enzyme in the electron transport chain is combining oxygen with NADH to make the hydrogen ions that drive ATP synthase. But something goes wrong when we get sick, injured, stressed, or just old. The mitochondria starts to make nitric oxide. The nitric oxide competes with oxygen. It binds to cytochrome C oxidase and competitively displaces the oxygen. This stops the production of ATP and increases oxidative stress. Oxidative stress leads to inflammation and cell death via the gene transcription factor NF-kappa B, known as the master switch for inflammation. Low-level laser and LED therapy breaks the bond between nitric oxide and cytochrome C oxidase, allowing oxygen to combine with NADH so that ATP can be produced and the oxidative stress to be abolished. Now the cell can get on with doing its job of regenerating tissue, fighting infection, or whatever it's programmed to do.
So if we see the clinical benefits of laser therapy, as I've already mentioned that there are 4 important aspects while treating with laser therapy. The first one is tissue repair and survival. In simple words, we can say that healing, improved speed and quality of regeneration of skin, muscle, tendon, bone, and nerves, improves tissue survival, resilience, so can be used prophylactically. So again, another aspect that rather than we treat the condition, we can also use laser therapy as a prophylactically to regeneration the skin, muscle, tendon, bone, and nerves, because we know that with the passage of time, with the aging process, the ligaments, tendons, they get degenerated, as well as there is lack of collagen also. The other important effect is anti-inflammatory, resolution of inflammation at least equal to NSAIDs, but without side effects. This is what I was saying, that this is the future of medicine, that laser therapy is directly challenging the medical aspects, different medications which are used for anti-inflammatory purposes. Edema, lymph node drain, more lymph fluid, blood flow. I have already mentioned that there is a benefit of laser therapy, that is angiogenesis, blood flow, increased blood flow. So analgesia, temporary 24 hours reversible inhibition of nerve conduction in small and medium diameter peripheral nerve fibers. As I have already mentioned, that high irradiance reduces ATP, which in turn reduces fast axonal flow and action potentials. Effects are like a neural blockage. All these effects are subject to wavelength, treatment time, irradiance interval, and maybe pulses. So this is very important that whenever if any patient comes to you, you have to assess whether you are going to treat the patient's pain first, or you are having the intentions of treating the patient, or you are going to improve the healing, or tissue repair is your purpose, is your objective. For every objective, like for lymph fluid, for other things, there is separate wavelength, treatment time, irradiance interval, and maybe pulses. Then the recent achievement, that is muscle performance, more strength, reduced fatigue, fast recovery. I will share in the almost in the last slide that there is achievement in the laser therapy. There is a milestone which has been achieved to increase the muscle performance of international players, even normal persons, international players, national players, that we can use this laser therapy for such purpose also. So what are our targets basically while treating the laser therapy? So these are again the 4: lymphatics, injuries, nerves, and trigger points. If you remember the picture I just shared, in which laser therapy focuses on lymphatics, treatment of nodes, reduce inflammation and edema, injuries, treatment of pathology to promote repair. Then we address the nerves also, that treatment over spinous processes, transverse processes, along nerves, over nerve plexus, stellate ganglion for symptomatically mediated pain above the shoulders, and treatment of the pathology if the injury is more than 1 centimeter deep. Similarly, trigger points, we can use it with trigger point locator. So you must remember the acronym LINT. lymphatic injuries, nerve and trigger points. Remember the name of therapeutic targets. So whenever we have to treat the patient, we have to consider all these 4 important points before, like if a patient comes with shoulder injury or like supraspinatus tear or supraspinatus tendinitis, rotator cuff tendinitis, you have to treat the condition at all these 4 points. You have to find out the trigger points all around the shoulder. You have to go for lymphatics to reduce the inflammation and edema. Similarly, at the point of the injury, our purpose will be to repair the tissue. Here is the frequency, here is the parameters of laser are different. But when we are going to block the nerve with the help of laser therapy, like we are going to treat the nerves on spinous processes, transverse processes, then there is a separate and different parameters. Again, just to go through with this, that electromagnetic spectrum, here you can see the range which are mainly concerned with us, that is 600 to almost 1000 nanometer. You see this is a visible red light. So whenever we use any infrared light, it also contains the visible red light in the range of 600 up to 700 nanometer, which is visible red light. Then between 700 to 1000, that is called near infrared band, which is normally called as pure laser. Then afterwards, infrared and microwave rays. So this is the brief going through of the electromagnetic spectrum. So wavelength, white light, just a brief difference between the different types of white light, laser light and LED light. White light, like tube light, the waves are different wavelengths, all different colors. Laser light, which we are talking about this, and LED light, this is monochromatic, one wavelength of light, coherent. Here you can see all are in same sequence and in the same arrangement, typically more power, high irradiance, and smaller beam sizes than LEDs. Like whenever we use the pencil probe or the probe with lesser cluster probe, they have more irradiance, more power in density as compared to smaller, as compared to LEDs. On the other hand, LED light emitting diodes, monochromatic, non-coherent, you can see there is little bit change in the arrangement or in sequence. This is called non-coherent, typically less power, lower irradiance, superficial, and larger beam size than lasers, so low power density. So this is the difference whenever we use LED light or laser light. Before we go further, there is one slide that you should all know that what is power and irradiance. Power is also called radiant flux, expressed in watts. The rate that photons are emitted is called power. Milliwatt, it is expressed in milliwatt. Like if there is 1000 milliwatt probe, it means it is spreading at least 1 watt, or similarly if there is 10 milliwatt probe is there, so 0.01 wattage is there. So when doing calculation, always work in watts. Irradiance is power density expressed in watt per square centimeter. The rate that photons are emitted divided by the beam area. Power over beam area is called power watt in square centimeter. Like in the above case, if the wattage is 0.01, like 10 milliwatt probe, and beam area is 0.2 square centimeter, then the total power density can be calculated as 0.05 watt per square centimeter. Similarly, there is another term that is energy. Power watts into seconds is equal to energy or joules. Example like 0.01 wattage, 10 milliwatt probe, and we treat the area with for 60 seconds, it will produce 0.6 joule energy. Fluence, again, it is the area that is wattage into time divided by beam area. That is the total energy we are putting inside. That is 3 joules per square centimeter. Here you can see the different recommended doses for tendinopathies by Jordal et al. 2001, that for epicondylitis, there should be wavelength, recommended wavelength 830 nanometer. There is fluence is 5 to 100 milliwatt per square centimeter, and this is the total energy 0.7 to 7 joule per square centimeter. Similarly, rotator cuff, Achilles, and wrist. For more detail, here you can see the VALT recommended doses. Recommended treatment doses for low-level laser therapy. VALT is World Association of Laser Therapy. For what? For 904 nanometer probe, the probe which is of 904 nanometer class 3B gallium arsenic lasers type. So these are the different condition diagnosis like carpal tunnel, minimum area or beam area, or the area on which you are going to 2 to 3 square centimeter. Minimal total dose required for minimum 2 joules per point is required. Here you can see the recommendation of World Association of Laser Therapy. So what happens if the wavelength is in the range of 780 to 860 nanometer? Then again, carpal tunnel 2 to 3 centimeter square is the points square, joules required 8, minimum 4 joules per point. So this is all the game of energy, what we are going to put energy. Too much energy or too less energy is of no benefit. Rather, it will increase the pain of the patient if we are going to give too much energy in the condition. So you have to keep an eye on the world recommendations of World Association of Laser Therapy whenever you're treating supraspinatus, infraspinatus, or any related conditions of musculoskeletal origin. So this is the treatment method, treatment chart. Like I have already mentioned that there are 4 important aspects: inflammation and edema decrease, tissue repair if there is any ischemia, analgesia, and trigger point. This is the same in one session, or whenever a patient comes to you for any type of condition, any type of disease. So this is the in one session that you always treat for lymph injury, for nerves, for trigger points. And this is the recommended, that whenever you want to repair or want to heal any area, always give a minimum frequency, that is 2.5 hertz, or in some machines it is 2 hertz, or up till from 2 hertz to almost 100 hertz is considered as the low frequency. Give it for 1 minute on each point twice a week is recommended, but daily is better. Similarly, when you see the analgesia, if you are having the intention, the patient comes to you with severe pain, and you have the intentions to stop the pain, to finish the pain, then you have to give it like 10 kilohertz, or similarly 20 kilohertz. You can give it for 30 seconds, not more than 30 seconds on one point, because if you will give more than 30 seconds, it will definitely give little bit discomfort to the patient. So 30 seconds are enough for the nerve blockage, and patient will immediately feel the relief in the pain just within 30 seconds, or after 30 seconds, he will definitely give you feedback that he or she is feeling better. Similarly, for trigger point and muscle spasm, you also again go for the continuous therapy, and for the like 10 kilohertz. Omega offers maximum 10 kilohertz, whereas Thor offers 20 kilohertz as well. This is treatment intervals. I think soft tissue injury acute best treated within 12 hours. Soft tissue injuries, chronic, twice a week. Joint condition, at least twice a week. Back pain, acute, best treated within 12 hours. Back pain, chronic, twice a week. Sciatic pain, acute, within 12 hours. This is the frequency of the treatment of laser therapy. Sciatic pain, chronic, twice a week. Neuropathic pain, twice a week. Non-healing wounds, twice a week. Similarly, post-operative pain, treated with within minutes of surgery. One treatment may be all that is necessary. So, what about safety? Few words on safety. Some LLT PBM products are class 3B lasers, others are LEDs, light emitting diodes. Class 3B lasers are potentially hazardous to the eye. Never stare into the beam or direct the beam into the eyes of the others. Patient, therapist, and observers to wear appropriate laser safety eyewear. Please make sure that use correct optical density for the wavelength laser used. Best to use the laser safety eyewear supplied with the product, not sunglasses or UV goggles. Remove key, warning sign, trained users. There are no known contraindications. Don't treat eyes with lasers. Class 3 or class 4 lasers could potentially damage the eyes. It directly affect the retina. Wear correct laser safety glasses. Never stare into the beam or direct the beam into the eyes of others. LED PBM can be used to treat the eyes if eyelids are closed. Eyelids are closed. Not researched, more research is needed. Don't treat cancer. Don't treat directly over the site of any known primary malignant carcinoma or secondary metastasis without oncologist permission. Exception, palliative care with informed consent and oncologist permission. We can attempt the side effects of after chemotherapy and so many other things related to cancer, but we are not allowed to right now till now that we should directly treat the primary malignant carcinoma or secondary metastasis. Pregnancy, don't treat over a developing fetus. Warn patient, mild adverse reaction, possible tattoos. Treatment over a tattoo with laser may cause pain as the dye absorbs the laser energy. The dye gets hot. Remove treatment probe from contact and treat 15 millimeter from surface. Very dark skin, remove treatment probe from contact and treat 15 millimeter from surface because dark skin absorbs most of the energy. Around the hairline, similarly inflammation, some patients may have symptoms aggravated after laser therapy. Again, this may be due to increase in dosage and due to some other factors. Like other modalities, we have to take care of certain things. But for low-level laser therapy, LLT, pins, metals, plates, implants, bony promises, these are not contraindicated. Care of equipment, wipe each probe after use with sanitizing probe wipe. Wipe the lens clean. Protect from liquids, best use in contact. So similarly, just like you take good care of your car and any other usable, so look after cables, don't stretch or pull at sharp angles. Test it for electrical safety and output every 12 months. So since being physical therapist, this is one of your prime responsibility to document your treatment. You have to describe the probe, whether you are using the cluster probe, single probe, a pencil probe of 100 milliwatt, 200 milliwatt, 30 milliwatt, location, time, pulse, record use of laser safety glasses as well. Important slide again, just few slides left. How fast does it work? Analgesia and trigger points, 1 minute. If you are a certified or you are an expert laser therapist, you have to, reduce the pain as well as you have to produce analgesia and trigger point within 1 minute. Inflammation and edema, 1 hour. And the effects of repair can be seen after 1 day, like you are going to treat for 3 to 5 minutes for any torn tendon or ligament with minimum frequency, that is 2 Hertz or 2.5 Hertz. With the cluster probe or with the pencil probe, you can see the effects after 1 day. Number of treatments sessions required: acute 1 to 5, chronic 5 to 20. How often? 2 to 3 times a week daily may be better. Then another important thing, that vascular tissues respond fastest. Non-vascular like ligaments, cartilage would take longer. However, the laser therapy will induce the angiogenesis, so there is a chance that it will enhance the treatment time. It will enhance the improvement or function or tissue repair. LLT is not antimicrobial, but laser therapy may help the immune system fight infection. So this is the line dedicated for COVID-19 that scientists are working. Even our World Confederation of Physical Therapy this time highlighted the role of physical therapist in COVID. Similarly, the laser therapy can improve the body defense mechanism, which ultimately improve the immune system to fight infection. There are few articles just to give you brief outlook of the laser therapy, the role of laser therapy worldwide. Laser therapy for chronic non-specific back pain, a meta-analysis of randomized controlled trials. We demonstrated moderate quality of evidence to support a clinical important benefit in LLT for chronic non-specific low back pain in the short term, which was only seen following high laser dose interventions and in participants with a shorter duration of back pain. Is photobiomodulation therapy better than cryotherapy in muscle recovery after high intensity exercise? A randomized double-blind placebo-controlled clinical trial. Comparing the results of MVCs between groups, we observed significant increases in the MVC capacity of all groups that included PBMTT, and a significant decrease in the concentrations of biochemical markers of oxidative damage. A systematic review of the effect of low-level laser therapy in the management of breast cancer-related lymphedema. So here you can see the role of laser in breast cancer-related lymphedema. As you remember that one of the important feature is to remove the edema. So again, conclusion is there is moderate to strong evidence for the effectiveness of laser therapy for the management of breast cancer-related edema, lymphedema from 5 small studies of acceptable methodologically quality. A dose of 1 to 2 joules per square centimeter per point applied to several points covering the fibrotic area can reduce limb volume following BCRL. Effects of low-level laser therapy and eccentric exercises in treatment of recreational athletes with chronic Achilles tendinopathy. Laser therapy with the parameter used in this study accelerates clinical recovery from chronic Achilles tendinopathy. Then long-term survival of randomized phase 3 trial of head and neck cancer patients receiving concurrent chemoradiation therapy with or without laser therapy to prevent oral mucositis. This is the first studies to suggest, by the way, this was happened in 2017. This is the first study to suggest that laser therapy may improve survival of head and neck cancer patient treated with chemoradiotherapy. Further studies with a larger sample are necessary to confirm our findings. This is again important and very interesting. The effect of low-level laser therapy on trismus and facial swelling following surgical extraction of lower third molar. Within the limitations of this study, it can be concluded that laser therapy can be beneficial for the reduction of post-operative trismus and swelling after third molar surgery. Here you can see the result with, which is compared with paracetamol and control, and laser. You can see the effects of laser. Effects of efficacy of low laser therapy on pain and disability in knee osteoarthritis. Systematic review and meta-analysis of randomized placebo controlled trials. This was published in 2019 in BMJ Open. The conclusion is LLT reduces pain and disability in knee osteoarthritis at 4 to 8 joules with 785 to 860 nanometer. So after going through all this lecture, at least you must know about the energy and the nanometer, that is wavelength, and 1 to 3 joule, that is energy, with 904 nanometer wavelength per treatment spot. So this is the NovoThor, the whole body light pod, which I have already mentioned that there is another important feature of laser therapy, that is to increase power, to decrease the fatigue, to fasten the recovery. What happens in America and in other sport-related countries, that before participation into any international competition, the international players, they come here to get treatment at least for 30 minutes. They lie down inside this huge tunnel of NovoThor, the whole body light pod. The literature shows that after having treatment of 30 minutes or 30 to 40 minutes, almost 30 to 40% of their energy increases after this treatment, and there is no role and it cannot be detected even through different scanning tests, or because this is the natural process, and it increases the power, strength, and recovery in the patient as well. So couple of slides on our upcoming courses. Future laser training courses with hands-on, inshallah. I have the intentions to treat my colleagues, my community people, that by providing different 2 to 4 week courses, like here, ankle and foot, cranial, central nervous system, ear, nose, throat, elbow and forearm, eye. So these are the 16 domains in which we can treat different conditions. There are more than 300 or 360 conditions which we can treat with proper evidence. For every condition, I can provide you the evidence that at least 8 to 10 or 15 references references in latest journals, in latest articles. Similarly, the specialized 6-week courses are also, we will also going to offer, which include stop smoking course, weight reduction course, stress management. These are the 3 specialized courses which I when I went to Glasgow and Edinburgh for having these kind of courses. The results are, although they are still in the moderate evidence, but there is huge need of treating such kind of conditions because of you can see the prevalence of smoking in our country and the weight concern of every other person. So I am very serious about this, inshallah, and we are going to introduce laser for such kind of services. So if we see the central nervous system, so each and every domain has again a list of so many other conditions. Like if we see the central nervous system, it has acute TBI, acute traumatic brain injury, chronic traumatic brain injury, Parkinson's disease, multiple sclerosis. You can see a list of at least 16 conditions. If we further see the stroke recovery, I just show you the stroke recovery. For post-stroke recovery, especially in acute phase, it is claimed that we can treat it with, we can enhance healing, we can enhance recovery in acute phase of stroke. Daily for treatment plan, daily for 5 days, then twice weekly for 3 weeks, then weekly for 2 months. Space out treatment as patient responds that further treatment is still needed. Intention is stimulate blood flow to the central nervous system. Our second intention is stimulate central nervous system and lymphatics to reduce inflammation, assist drainage. And our third intention is heal injuries and reduce inflammation. So laser therapy will resolve all around pain or healing. Here, the healing effect is more required. More blood flow is required to the central nervous system. This is a kind of recommended probe. Pulses you can see, 2.5 hertz. which I already mentioned, that always use minimum frequency for any kind of healing. Especially in stroke, we need healing. We need to increase the blood flow. So 2.5 hertz is recommended. Treatment targets bilateral internal carotid arteries and vertebral arteries, sigmoid sinuses, jugular foramen, bilaterally external occipital protuberance, treat affected lobe. So here you can see the picture of while treating the patient, which I just mentioned. These are the important points. For example, if right CVA, so this is the area of injury. The weakness is on the left side, so you always treat the area of injury. And this is all external protuberance and vertebral arteries, carotid arteries. These are the important points which we should treat at least for 1 minute with the frequency of 2.5 hertz. So this is the one condition. Otherwise, I have more than 360 conditions for which we can give you the recommended dosage, recommended areas where we can put laser therapy with cluster probe or pencil probe. And particular for this kind of stroke recovery, here you can see the evidence like Michael Hamblin, who is the director of Center of Wellness in Harvard Medical University. He's my mentor as well, Michael Hamblin. He has also contributed a lot for photobiomodulation and photodynamic therapy as well. So here is these are the projects which are under consideration right now. So for every condition, for every dosage, there is a specific evidence. So these are the reference